Hello, everybody. Thank you for the opportunity to tell you a little bit about what we do here at Fox Chase Cancer Center. My name is Dr. Alexander Kutikov, and I'm the Chief of Urologic Oncology at Fox Chase. I want to talk a little bit about building bridges between international patients and providers and the care that we provide here at Fox Chase Cancer Center. So it's a very large team of genitourinary oncologists, both surgical, radiation, and medical oncologists. It's 5 medical oncologists right now, 6 GU surgeons, and 5 radiation oncologists that provide care to cancerous patients with genitourinary malignancies. We do over 1,000 urologic oncology cases a year, and we really have a national, international reputation as thought leaders in the field. We do very high complexity surgeries. We treat patients with high levels of comorbidities and really offer care that requires a high level of nuanced expertise. So I want to talk a little bit to each of these aspects of the care that we provide. Obviously, we do the cases that require sort of extra level of surgical expertise, large tumors, recurrences, tumors that have been previously treated with radiation. We very much like seeing patients like that here at Fox Chase, where our surgical expertise can be put to use. We care for patients with testicular cancer, post-chemotherapy, retroperitoneal lymph node dissections. We'd love to see those patients and help with those, since those are rare cases that many surgeons in the communities don't get to see. We do complex laparoscopic and robotic surgery, and this is really where we excel. We, a lot of the times, can perform minimally invasive surgery for tumors and in difficult locations that other centers really can only do through large incisions. We also provide very complex, minimally invasive nephron-sparing surgeries for patients with kidney cancer. In other words, we have a particular interest in seeing patients with tumors in challenging locations on the kidney, whether it be in the posterior surface or around the renal hilum, where a partial nephrectomy may be challenging. And this is something that we do here frequently and at high volumes, and really not only sort of participate in the care of these patients, but also are very much in the lead as far as contributing to the medical literature in this space. Here's an example where, actually we're very much part of the conversation out there on which patients need nephron-sparing surgery and which patients could benefit from a radical nephrectomy, and this kind of expertise and the kind of opinions that we would love to render here for a patient. We do retroperitoneoscopic, both laparoscopic and robotic surgery, and these are cases that are at times very complex. Here's an example of a patient with a colostomy, where at most centers this would be a large incision. Here we can provide robotic surgery for, in this case, a partial nephrectomy, where we go behind the bowel sac, avoid the scarring from previous colostomies, and really have the patients go home the next day or the day after rather complex surgery. For bladder cancer patients, we have extremely high level expertise in this space. We provide neoadjuvant chemotherapy, bladder sparing approaches. We have a number of clinical trials, but we also do, from the surgical perspective, provide continent urinary diversion work, and also obviously ileal conduits for patients who need their bladders out. We obviously, every tumor and every patient needs to be treated in the context of their comorbidities, and we obviously at a tertiary referral center like ours see lots of patients with lots of comorbidities where they need complex work, and we're glad to see and help with patients in those situations. So there's some examples here: patients with large tumors who maybe are debilitated. There's also, especially in the current era of drug-eluting stents and antiplatelet agents and anticoagulation, the eye of the needle needs to be threaded very carefully in order to balance the risks that wrap around these complex patients' care, and we're always glad to help out with these complex decisions and complex procedures. So the expertise is really key. We work with a group of very talented medical oncologists, radiation oncologists, urologic oncologists, pathologists, and radiologists to really put together the complete story and to really make sure that we're taking the patient in the right direction and managing them and providing them the best care possible. Some examples, for instance, the pathology expertise here is really extensive and extremely high level. And so, sometimes people's destinies get changed by our pathologists simply reviewing the slides. Here's an example of a young woman coming to us. Pathology review here finds micropapillary disease. It's a very aggressive variant of bladder cancer. Obviously you pivot towards more aggressive therapy in a patient like this. Whereas, sometimes we pivot in a different direction. Folks come here with muscle invasive disease. Pathology, world-class pathologists look at it and are able to render diagnosis of non-muscle invasive disease on review. And these patients often have the possibility and the chance to keep their bladders. We do and we measure. We have one of the largest kidney cancer databases in the world. This is data as of 2017, over 3,000 patients, and now many more. Have a very large and robust prostate cancer database. And, we have deep expertise in prostate cancer here, both in localized and systemic disease. We obviously performed a large, high volume of robotic prostatectomies. We're also glad to see patients who cannot have robotics, for instance, patients who've had extensive abdominal surgery like colostomies, and we're able to offer traditional open techniques. But for most patients, robotic prostatectomy is our go-to procedure, and we have extremely experienced surgeons who are able to help with in that disease space. We're heavy contributors to the world literature. In just the 5 years from 2012 to 2017, our team has contributed over 450 PubMed Index publications in journals anywhere from New England Journal to the Lancet to European Urology to JCO. So, by sending patients to us, you really will be sending them to some of the thought leaders in this genitourinary cancer space. Multiple clinical trials are open, and they do enroll international patients, and some of these opportunities to really see some of the most exciting agents that have not hit the market yet, but are being available here at Fox Chase on a trial basis. I also want to just highlight our expertise in management of adrenal mass. This is a relatively common problem that sometimes expertise in this management is lacking. We have deep endocrine expertise, deep minimal invasive surgery expertise, and comprehensive cancer care for the rare adrenal cortical carcinoma patients. And we're glad to see those patients, work them up, and render an opinion. A lot of these patients do not need surgery, but do need to have an evaluation. And we're glad to see them here in Fox Chase and help with their management. It's a two-way bridge, as I mentioned in the beginning. And we'll work closely with the providers who will entrust with the care of their patients. We'll see patients expeditiously. We'll send patients back if they simply want an opinion and don't want to provide care, but just want reassurances that their care is in the right direction. We will navigate and calibrate care closer to home as needed, obviously, and we'll make sure that we provide timely communication to the providers that send patients to us. Please don't hesitate to contact us. We're very happy to help you with your patients at any time. Thank you.